Thank you, Dame Caroline. It's a pleasure to serve under your chairmanship, and I beg to move that this House has considered healthcare services in Carshalton and Wallington, and it's very grateful to the Speaker's Office for granting this debate again to talk about the important issues facing the NHS and patients living in my constituency. Not only is this going to be an opportunity for me to raise the good work that is being done by our local NHS staff, but I do want to focus in on 3 or 4 particular issues. But I would like to begin by thanking the Minister and the Department for Health and Social Care for their continued engagement with me over the course of the last few years. I know that they must be getting sick of my name coming up on their phones, but they have been very, very gracious with their time, and I am very grateful to them for that. But if I could start, Dame Caroline, with one of the most pressing issues facing our local healthcare in Carshalton and Wallington, which is, of course, our local hospital, St Helier. I won't dwell too long on what it means to me, as I've said this before in other contributions, but it was the hospital that I was born, most of my family were born, it saved a number of my family members' life, and not too long ago it saved my life as well. So I have a great sense of personal loyalty to this hospital. And the staff there do an absolutely incredible job. They really do. And they are doing it under now what are very, very difficult circumstances, because the hospital is incredibly old. It's older than the NHS itself, and that is starting to show. The hospital suffers from more than just outdated aesthetics, but it is also now very much showing in the disrepair of the hospital, which is evident if anyone has to visit St Helier. It's also been the subject of numerous news articles and television exposés in recent months. The BBC, ITV, The Observer, all have covered the state of disrepair at St Helier. And these range from a number of things, from the sinking foundations, the faulty lifts that are so old that the parts to repair them aren't readily available anymore, the leaking roofs causing wards to be closed, or a litany of many other problems. And my inbox regularly features emails from patients who have had to deal with the fallout and the repercussions of these issues when visiting the hospital or waiting for treatment, alongside stories and reports from the staff themselves that work at the hospital. But as I say, the staff there are doing an incredibly good job on very, very difficult circumstances, which is why I am so pleased that the government has recognised the good work that the Epsom and St Helier Trust do, agreeing to the multi-hundred million pound investment to upgrade St Helier and build a new hospital, a second hospital in the London Borough of Sutton. However, it's no secret that we've been waiting on the next stage of this for some time, so I would be grateful to hear from the Minister when we might be able to expect an update on the next stages of the new hospital programme, but also invite him or members of the Department of Health team to come down to St Helier to see some of these issues for themselves. And just to go into a bit more detail, Dame Caroline, about what this new funding will provide, as well as improving St Helier and bringing it into the 21st century to provide modern medical care, it will also provide a second hospital working in partnership with the Royal Marsden in Sutton to provide specialist emergency care for the sickest patients living in the borough. It will also develop a partnership with the cancer hospital next door so that more cancer treatments can be done in the London Borough of Sutton without having to transfer patients to the Chelsea site instead, which can be difficult considering that the connectivity between my part of London and Chelsea is not fantastic. So this is really, really exciting news, and the Trust are raring to go. They really, really want to get on with this, which I think is why they have been so keen to highlight these issues in the press over the past couple of weeks. They are very keen to get going. Now, the pandemic has caused a delay to the timetable. I completely understand that, but we are still waiting for that all-important decision. So, I know I've secured assurances before that the plan is in development. But I just hope I can relay that there is a sense of anxiousness felt by the staff that work there and my constituents who want to see progress being made on the new hospital. It is the biggest single issue relating to local healthcare provision that comes up time and time again. And having worked in the NHS myself locally, I know full well how much this is needed, not just to ease demand on St Helier, but to improve patient outcomes, to allow for those more specialist services and treatments to be carried out locally. And this includes protecting services that under previous iterations of healthcare planning in our local area, which ranged from everything from reducing services to closing St Helier altogether. This is the first time that the NHS has been able to come forward to the government and get agreement from the government of the day to fully fund a plan which will not only protect services in the borough but improve them as well. And that does include making sure that A&E, critical care, acute medicine, emergency surgery, inpatient paediatrics and maternity services all protected within the London Borough of Sutton and not transferred elsewhere. And that is incredibly welcome news. But again, we do need to see progress. And what I like in particular about this is that this is not a government reorganisation. This isn't bureaucrats sitting in the Department of Health and Social Care. This is the department having listened to what the NHS has said that they need to provide good quality healthcare in the London Borough of Sutton. And the department has agreed to listen. So that is fantastic, but we do need, again, to see those next steps. But I'd like to touch on, in the time that I have, just a couple of other issues facing healthcare provision in Carshalton and Wallington, particularly in relation to access to local GPs and dentistry provision as well. Now, we have some fantastic GP surgeries made up of incredibly hard-working teams, from the GPs themselves all the way through to the advisors, triage nurses, reception and admin staff. However, I am hearing from constituents that they are struggling often to get an in-person appointment, and particularly older constituents struggling to navigate some of the new technology, which I completely appreciate the need to do. But I would welcome anything the Minister can say about encouraging GP surgeries, for those that do find the digital world difficult, to make it easier on them to access an in-person appointment when they need one. Because I've had many cases now where these people have come to me and said that they've had to take themselves off to the emergency department because they just simply cannot navigate this new online booking system that many of the GP surgeries now have. Now, I'm sure the Minister will agree that this is not what we want to see. It puts an incredible strain on the healthcare system and emergency medicine when it's already under immense strain. And primary care, of course, was one of the hardest hit sectors during the pandemic, and it is clear that there remains a backlog, both in terms of existing conditions and those who put off seeking help during the pandemic. And it is heartening again, and the government should be congratulated on their recent announcement of £240 million specifically aimed at GP practices, aimed at getting patients an appointment, avoiding the so-called 8 a.m. scramble. But the 8 a.m. scramble still is very much a thing for many of my constituents. It's still something that I hear far too often. So whilst I do welcome this, I would really welcome any update the Minister can give on where he believes we are in terms of recruiting new GPs, retaining those that are working in the sector, and how we're going to deliver on those promises to our constituents that they can access a GP whenever they need. And could I add in a suggestion to help with that? And I was really pleased to see the Prime Minister talking up the importance and the role that community pharmacies can play in this, in providing a range of services. It's incredibly welcome to see that recognition of pharmacies, many of which I think they went unthanked during the pandemic because their doors were left open whilst GPs largely weren't seeing patients face to face. Pharmacists are doing an absolutely incredible job, but as we know, I don't have time to go into all the issues now, but the Minister will know from previous conversations we've had about the immense struggles that they're facing in terms of the way that the reimbursement scheme for drugs is set up, and the fact that they cannot balance the minor ailments ailments treatments and the minor ailment advice that they give with the time that they have to make where the money is in terms of dispensing drugs. So I would really welcome any update the Minister can give or any commitment that he can give to go away and look more in depth at what role community pharmacies can play in supporting our local healthcare system. But finally, I want to move on very quickly to touch on dentistry. And I know that I spoke about this in a Westminster Hall debate not that long ago, but I did just want to reiterate a few key points, because I am still getting some horror stories of people that are turning to DIY solutions and people who are struggling to access a NHS dentist. And I've met with local dentists in my constituency, and they've been very clear that the dental contracts as set up, the way that the UDIs work, and the way that they get reimbursed for the work that they do, disincentivises them from doing more. And many of them are saying that it's going to be simply impossible to meet the targets this year in order to avoid money being clawed back. And they are really worried about that clawback coming and what effect that is going to have at the end of the financial year. So again, whilst I welcome that there has been money, £50 million indeed, to put into dentistry to deal with the backlog, there are long-standing system-led issues in dentistry, which span multiple decades and multiple governments. But the pandemic really, I think, has brought this all to a head. And I would really welcome any update the Minister can give about what work the department is doing to look and reform at the way the dental sector is set up so that people can access NHS dentists a lot more simply. Now, of course, Dame Caroline, there is no magic wands that we can wave to solve all of this overnight. But we can certainly do some things to get us there in the meantime. And one of the things that I hope that the department will be able to do very, very soon is to let us know what the next steps are for the new hospital programme. That will be incredibly welcome. What assurances the Minister can give that the maintenance problems that do exist aren't impacted by the new hospital programme, but they can access funding to deal with some of those maintenance issues at the moment, and what work the department is doing to ensure access to GPs and NHS dentists so that we can improve and continue to work on the most important thing that we all want to see, both government and the NHS, which is a better experience for patients and better patient outcomes. Thank you, Dame Caroline.
The question is that this House has considered healthcare services in Carshalton and Wallington constituency. Minister Neil O'Brien to respond.
Well, thank you, Dame Caroline. I must thank my honourable friend for securing this important debate and also pay tribute to him for his incredible campaigning work on this over the years. He has been absolutely relentless, like the unstoppable force, and hopefully in the near future we will come to an announcement and all of our phones can slightly recover as ministers, and the hard work that my honourable friend has put in will hopefully pay off in campaigning for the hospital that he was indeed born in. So I know how important this is to him at so many different levels. Today's debate is, in one sense, well-timed, in one sense, badly timed, insofar as we are hopefully coming towards a moment of announcement and decision in the very near future. So that might be slightly frustrating from my honourable friend that I can't say more today. But let me set the scene a bit about where we have got to with the new hospital programme. We're working very closely, as my friend knows, with the St Helier University Hospitals NHS Trust on their plans for a new specialist emergency care hospital in Sutton, with acute services to remain at the current Epsom and St Helier hospitals, a key point that my honourable friend has been calling for. And this is part of our wider plans to build 40 new hospitals. All the schemes within that programme have been grouped into cohorts on the basis of readiness to progress and the extent to which the schemes can realise the benefits of the national programme work. The Epsom St Helier scheme is cohort 3 Pathfinder scheme, which means it will be one of the very first of the larger and more complex schemes to be taken forward in line with the national programme approach. And the programme has developed an integrated systems approach known as Hospital 2.0, which spans the whole hospital life cycle from business case and design through to construction, commissioning and handover. And the use of Hospital 2.0 is the vehicle through which the national programme approach can ensure that we get the maximum value for taxpayers' money and deliver more efficient and effective designs of hospital. Our Hospital 2.0 process will drive efficiencies of about 25% compared to traditional means of driving infrastructure. And the Trust is currently at the outline business case stage, and we are working very, very closely with them to incorporate that national standardised approach. To date, the Trust have received £20.5 million in public dividend capital to progress their scheme, and that includes fees for design works and a contribution towards the costs for a new electronic patient record system. And further allocations for the scheme, including through the total individual allocation, will be decided through the proper business case process that will ensure it's deliverable and it's aligned with the national programme and delivers value for taxpayers in my right honourable friend's constituency. And we're planning a range of events and communication around the decisions that we are making on this in the near future, and I'm sure that the honourable member will be the first to engage with us on those in the very near future. So, frustrating perhaps that I can't say more today, but I do pay tribute to my right honourable friend's incredible work in making the case and helping, in fairness, his local NHS to make the case for the investments that he's calling for. My honourable friend touched on also on general practice, and I absolutely recognise some of the pressures that we've been seeing in general practice during and afterwards the pandemic. And that's why on the 9th of May we launched our primary care recovery plan, designed to tackle, as my honourable friend said, the 8 AM rush for appointments, which isn't good enough. Just this week, earlier on this week, we delivered ahead of schedule our manifesto commitment to put an extra 26,000 additional staff into general practice. We said we would get 26,000 by next March. In fact, we've delivered 29,000 now, so well ahead of schedule. And of course, as well as those extra clinicians like physios, pharmacists, paramedics, all those extra people in that wider GP team that we now have in general practice, we are of course also taking action to retain our invaluable experienced GPs, and that's why we have made significant reforms to GPs' pensions, lifting 8,900 GPs out of annual tax charges and helping to retain those invaluable GPs. And as part of that primary care recovery plan, as my honourable friend noted, we're investing £240 million in new technologies for general practice, both up-to-date phones so that no one ever calls and gets an engaged tone, and also good, high-quality online systems so that people, particularly people who are older or find it more difficult to use the internet, can always navigate their way through it simply. What we find when these systems have been deployed well is that a very large number of people start to use them. They're very, very convenient, they're well designed, and that takes the pressure off the phone, so it's much easier for those who do want to use the phone to get through. So another significant investment, and of course on top of that then, we're investing £645 million over the next 2 years in the new NHS service, Pharmacy First, which will also take the pressure off GPs because that will enable people to go to their community pharmacy, often in a very convenient place in the high street or in people's neighbourhoods, to get treatment for a range of common conditions, and for the first time pharmacists will be able to supply a range of antibiotics and directly take the pressure off GPs by enabling people to get the treatment they need in a convenient way. My honourable friend also touched on dentistry, where we've started to take action, but we know we have to do more, and our dentistry plan will be following, I hope, hot on the heels of that primary care recovery plan. We've already started to reform that problematic 2006 contract that the last Labour government put in. We've allowed dentists to go to 110% of their normal delivery so that those who do want to do more NHS work can. We've started to make NHS work more attractive by better matching the payments that dentists get to the cost of the work that they're doing, and we've brought in minimum UDA rates, minimum rates of payment to support dentists where their rates historically set have been very low. That is starting to have an effect. In the year to March, dentists saw about a fifth more NHS patients than they had in the year before, but we know that we have to go further. We know it isn't good enough at the moment, and that we will be producing a radical dental plan in the very near future. But once again, let me thank the honourable member for bringing all these issues to my attention, to the attention of every other minister in DHSC, and I hope that he will feel that his hard work over a very long period on behalf of his local NHS and on behalf of the hospital he was born in will be rewarded, and I hope that we will be able to say more about that very shortly.
Thank you. The question is